Hi, I'm Joanna with Blissful Baby Sleep Coaching, and I am here for my second interview with Laura Yu of Yu Physical Therapy. And our first conversation, which I'm really hoping that you will listen to, was all about the importance of the pelvic floor for a woman. And it was such a compelling topic that I definitely wanted to have Lori come back and speak with you about what is known as the mommy pooch. So as we all know, we get pregnant and we have our babies, and as we're trying to kind of regain our body, sometimes we have a little bit of extra around the midline. And there's this misunderstanding or this concept that if we do enough planks and we lose enough pounds and we do our core strength exercises, that this will magically disappear, hopefully, after a lot of effort. But what Lori's going to talk to us about today is what is the nature of that mommy pooch and what are the better ways to actually manage it and get back into shape besides torturing yourself with planks and ab exercises, because that actually could actually make it worse. So this is, again, just really important information that I want to share with all the moms out there, because as I mentioned, I'm always trying to get out into the community to learn and understand everything that moms need to know to be the best mom they can be. And when I discovered Lori's vast knowledge and her commitment to women's wellness, I just knew that I had to talk to her, and I'm sure we will have her back again and again and again, because her experience is so diverse and her passion for supporting moms is just like mine. So here's Lori. She's going to tell us all about mommy pooch and what we can do about it. Thank you, Lori.
Well, thank you, Joanna, for having me back. So I wanted to talk about what's called diastasis recti. And it's becoming a little bit more of a popular term. But again, I think when I say the mommy pooch, that's exactly what moms connect with immediately. You know, I've lost all my baby weight, but I'm still stuck with this. And the question becomes, well, what is this? Is there still just weight on you that is just staying stuck in the belly, which could be the issue? It could also be excess of loose skin. So, you know, we look at that when we're going through assessments, or it could be diastasis recti. And what diastasis recti is, you have what's called your linea alba, and it's this connective tissue band that connects both sides of your abdominal muscles. In this case, specifically the rectus abdominis, that's those six-pack abs that everybody knows about very well. And so from being pregnant, as the baby is growing and those abdominals are stretching, everything is getting stretched, including that linea alba. And we also have extra pressure within the abdomen. And over time, that extra pressure, the extra weight, the expanding abdominals, again, they get stretched and they get laxed. And now, okay, baby comes out, and here we are still with this pooch. And I think we all, you know, as us moms who've gone through that, even, you know, once the baby is out, even, you know, a week, 2, 3, 4 weeks down the road, you still look like you're pregnant, right? And so part of that is, yes, there's still some swelling, there's organs that need to go back into place, and then the abdominals. And unfortunately, those are kind of the last that come in over time. And so when you're seeing that mommy pooch, that residual abdominal weakness, that's what could be still haunting, you know, some of those moms out there. So with the diastasis recti, this is really important to understand, because again, when you go to your OB, they're not checking you for diastasis recti. Again, they're checking to see how you're healing, and either you are or you're not, and then out the door you go. So just like we said in our first video, they're not checking really the strength of your pelvic floor to see how that is also rehabbing post-baby. And they're not checking to see if you have this splitting of the abs, the diastasis recti. So what can happen over time with diastasis recti is, you know, you start to just get that nagging back pain, or again, you don't feel complete in the center. You don't feel as strong. You try to get out of bed and you're like, you know, you still need to like use your hands. There's still some general weakness, and it's different for everybody. And I have to say, the strength of your abdominals going into a pregnancy, if they're strong to begin with, you may have less of this issue coming out. Now, that's not to say by maybe your second or third kid that what you had the first time around and you didn't have the mommy pooch may not show up at kid 2 and 3, especially if you're not taking care of this problem. If you have more weaker abs going into pregnancy, then you may be setting yourself up also for a higher chance of getting this diastasis recti. So when we're dealing with diastasis recti, you can actually do a really easy self-test at home. And so I actually have videos of this on my YouTube and my Instagram page, but it's super easy. You just lay down on the floor with your knees bent, and you're going to take your 2 fingers, they're going to be horizontal, and you're going to find your belly button. And all you do, it's not even a sit-up, you just simply take your chin to your chest. And what you're feeling for is, do your fingers fall into a hole? And if they do, how deep is that hole? And also, how wide is that hole? So it could be 3 fingers, 4 fingers. Again, it's different. 1 finger, it could be different for everybody. So you get a sense of what's happening at the belly button, because that's the most common area. Then you go about 2 inches above the belly button. Same thing, hold your fingers horizontally, chin to chest. And again, you're feeling, is there a hole? How deep does the hole go and how wide? And then again, 2 inches below the belly button, and getting that sense. So you can have a diastasis recti at the belly button and no place else, or above it, below it, it could be all different. So what does this mean? Okay, so now you have this gaping hole, right? What that hole essentially is telling you is that over time, if this goes untreated or the problem gets worse, you can end up having a hernia, because you have a hole in your abdominal muscles, and so intestines, that's what causes a hernia. The intestines can come out into the out of the abdominal muscles and cause a hernia. And the umbilicus being the most common area where we typically will see hernias happening. So this is why it's important to at least be assessed. And pretty much any postnatal fitness specialist has been trained in this, in addition to myself, who are pelvic floor physical therapists. So it's just a good idea to kind of get an idea of where are you post-baby, because again, you want to be able to recruit that core back to what it was prior. And the sooner you do that, the better. Now, that's not to say that, you can't go through and have your babies, 3 kids, and that this wouldn't be rehabable. It's just going to take a lot more time, because what happens is if you don't get it corrected or at least tested, knowing what's happening after, say, your first baby, then you go right in, you have a second baby. Those muscles are still laxed and loose, and now you're stretching them again, right? And now you go, say, to baby number 3, and again, you're stretching them. You didn't correct them the first or second time. They're even looser, and now you're stretching them again.
So what I understand you're saying is that, as you go through pregnancy and you give birth and your body's in recovery, that there's the tension is not going back because there hasn't been any deliberate effort on your part to know how well that's healed.
Exactly.
And so sometimes the mommy pooch isn't extra weight, nor is it your lack of doing the right abdominal exercises. It could actually be this issue. What's it called again?
You're not getting the appropriate tension back in the abdominal muscles.
Right.
And so that's the other thing, we get very fixated. I have a lot of clients that come in and they get very fixated on, is my gap getting smaller? Is my gap getting smaller? And here's the thing, it's not so much about the gap, because it's about having a functional diastasis, okay? And getting that to be functional is about building that tension back. So when you do that test, and if you feel really squishy, your fingers fall in, there's no tension there. And that's what we want to get back. It's not so much about the gap, because if we get tension back and you are taught appropriately how to create the appropriate tension through proper breathing and exercises, then really the gap doesn't mean anything. So that may or may not change. I don't like people to be too attached to the gap's not getting smaller than that gap, but it's like, you've changed the tension. And because you've changed the tension and you know how to recruit the proper tension, same thing, you will see changes over time of the belly getting smaller and flatter.
Right. Okay. So the way to manage this baby pooch is really to get a proper assessment.
Mm-hmm.
and make sure it's not this tension issue. And if it is, then there's a very specific protocol to go through with the breathing and the specific exercises in order to bring back the tension. And over time, as the tension is created, then the body responds appropriately by getting, by slimming and getting tightening. And again, it's not about how many planks the fact that you can hold a plank for 2 minutes, which, my goodness,
Correct.
But so can you talk about how maybe doing the wrong abdominal exercises, assuming that could actually make it worse? Can you talk about that?
Absolutely. So one tip, again, if you start to really research this, topic, you'll see a lot of things of saying, don't do sit-ups, don't do planks, and don't do crunches. And I would agree with that. I'd say 80% of the time, but there are those women who, even if they have a diastasis recti, if they are able to recruit their core the way that I'm teaching them and they catch on to it really quickly, then those exercises may not be harmful to them. But I always tell people, if you don't know, be cautious and stay away from those until you have a formal assessment, and then you're clear to move into those harder exercises. And the reason being, those exercises increase intra-abdominal pressure. And so again, you kind of go back into you're not pregnant, but you're increasing that intra-abdominal pressure, which again is pushing the abdominals out, pushing that connective tissue out. And what is our goal with correcting the mommy pooch is to bring that all up and in.
Okay.
So this is where the breathing comes. So again, you're assessed for the diastasis recti. And the first thing that I teach somebody to do is to find and connect with their transverse abdominis muscle. And I like to actually go on hands and knees, because they could actually look at their belly, and as they take a nice deep breath in, you want that belly to drop and to get heavy. And so you get that tactile feedback, because the rehabbing a diastasis recti actually has more to do with retraining the brain and the nervous system. And the muscles, will kind of follow suit.
Okay.
So as you're on your hands and knees and you're breathing and you're taking a nice big deep diaphragmatic belly breath, you feel the weight of the belly drop down. You blow out through the birthday candle lips as you try to draw that belly button up and back into you, like you're putting on a tight pair of pants. What you want to be careful not to do, because again, if there's significant weakness, people will try to substitute and kind of arching around their back to draw in the belly. You don't want any movement through the shoulders or the mid-back.
Okay.
It's just the belly dropping and the belly coming back in.
Okay.
And that starts to make that brain connection to the muscle that we need to wake up. Because it's actually the transverse abdominis muscle that needs to be rehabbed, which is woken up. Yep, and woken up, because the way that the transverse abdominis muscle is in our bodies, literally it goes from one side of your pelvis to the other. It's the natural corset.
Yeah.
So as we pull up in on that corset, we're going to pull in and strengthen that tummy to get flatter. Whereas when we're doing the sit-ups and the planks, we're technically pushing those muscles back out. Okay.
So to all the moms out there that are listening to this and they're like, wow, I've never been assessed with this. Where do they go? I mean, who do they go to? Their OB? Can they go to their internist? Do they have to find a pelvic floor specialist?
That would be the best, honestly.
Okay.
We're the ones trained in it. So they could always Google postnatal specialist to see who and what pops up, within their area.
Okay.
And then again, finding a pelvic floor PT.
Okay, pelvic floor physical therapist.
Pelvic floor physical therapist. And one thing that I tell people to at least start with a pelvic floor physical therapist, because yes, the assessment of the diastasis recti is external, but when you're working on that core breath, you also have to pull in the pelvic floor, which is that Kegel, right? Yeah. And so only pelvic floor physical therapists are the ones who can actually, again, it's an internal exam.
Right.
So if you're going to go get assessed, kind of get assessed with everything.
For everything, right.
And then you can know better what's going on and then find, other people if needed.
Okay. So, and again, you guys, we will post in this attachment here, Lori's website and the links inside our website where you can do this personal assessment. And there'll also be an opportunity for you to talk to Lori a link there where if you want to schedule a phone call with her to get her ideas or recommendations. If you're not local, but you don't know where to go or you're having a hard time finding, you can schedule a time to talk to Lori about your concerns. But I kind of feel like what the takeaways here are that as part of our post-birth recovery, an ideal world, if you've had a baby in the last year, absolutely, without question, you should be getting a pelvic floor physical therapy assessment to not only identify with how your pelvic floor is doing post-birth, but to also explore this belly pooch issue and to make sure that it's not due to weight, that it's actually due to the tension not being properly attended to, kind of like she said, that natural corset that we have in our abdominal system, so that you can get help with both the pelvic floor coming back into shape and this abdominal area coming back into shape in the proper way.
Correct.
Instead of just assuming that you're planks. Now, if you are a mom that, has a second baby and a third baby, or you're a baby that had, a mom that you had babies several years ago and you're thinking, oh my gosh, I never knew about this. What should I do? What Lori and I were talking about earlier, she says it's never too late, right? Mm-hmm. So that, yes, like for example, me, I had a baby 15 years ago, right? And I've never seen a pelvic floor physical therapist, but I recognize now I better go see one. Yes, maybe I might have 15 years worth of non-activated muscles, but it's never too, if I put concerted time and effort into this, my body will go back to adaptation.
Yes.
It's just a matter of finding the right therapist to work with me on what my particular situation is to really recover fully and maintain my pelvic floor health, which will help me later in life. If you guys listen to our original conversation, we talked a lot about that Lori's career started with working with the elder population in geriatrics, and she got to see 60, 70, 80, 90 years of age, poor women that had no pelvic floor capabilities whatsoever, which meant that bladder control was a huge issue in their life. Even if the rest of their body was well and their mind was well, they still had this issue. So what we're trying to say to you guys is no matter what age and stage you're at, this is now part of us as women taking care of our bodies and getting the right help and the right assessments and making the concerted effort to do what we need to do to keep our pelvic floor and our abdominals properly supported so that they can ultimately support us. Did I get that right, Lori?
Yeah, very much so. And one thing I want to also kind of touch upon really quickly is, especially for those breastfeeding moms.
Yeah.
Again, our hormones are out of whack, right? With all of that. And again, whether you're breastfeeding or not, post-baby, there's hormone fluctuations. The longer you breastfeed, again, hormones are not going to be into balance. And so it makes it harder, and it's not, I shouldn't say harder, it just takes more time for that connective tissue to respond, because our connective tissues also respond to hormonal fluctuations.
I see. Okay.
So the point is be patient.
Mm-hmm.
Be patient. You can still be working with your postnatal specialist so that you're at least recruiting those muscles, bringing tension awareness back into them. And again, as breastfeeding wraps up, as you start to readjust hormonally, you'll continue to see changes.
Great. Thank you so much, Lori. I know we'll have you back again, especially as I start, getting more questions from all of you. If you have questions for Lori, either email her and get on her schedule, or you can email us some topics you want us to explore, and we'll get it going. So thank you so much, Lori. So much enjoyed our conversation, your wealth of knowledge. Thank you.
Thank you. Bye.
Okay. Bye.